Hello, this video is about microdosing psychedelics. So let me introduce myself. My name is Dr. Michael Villanueva, and I am a clinical psychologist here at the Alpha Theta Center. Here we map the EEG, we map the brain, we develop neurofeedback protocols. And what I do here is going to become more relevant to you as I go through this video. So let me tell you who this video is for first. This video is for people that are considering microdosing, are interested in it, but are having a hard time wrapping their minds around the whole concept. So to that audience, I say, stick around and listen. This video is absolutely not a how to microdose video. There's plenty of information out there on the web if you want to get into the specifics on how to do it. This video is also not a review of the scientific literature on microdosing or psychedelics in general. That would be way more than we could possibly cover here. What I'm going to share with you are my clinical experiences, so to speak, over the course of the last 5-6 years and what I've observed in people who have microdosed, the EEGs I've recorded, and how that might be relevant to your decision process. So I've organized this video into several sections. First is safety, risk-benefit analysis, and how you can think about that for yourself. Secondly, I'm actually going to define microdosing, which is very easy to do at this point. I'm going to discuss expectations. I'm going to talk about the choices you have. I'm going to share my observations. And of course, naturally, I will end with caveats and warnings. I have experience in researching psychedelics in different countries. However, that being said, I am neither endorsing nor condoning the use of Schedule I substances here in the U.S. So for those of you who like to do things on your own, let me be very clear right up front at the beginning. Your best sources of information are go to pubmed.gov and type in psychedelics or your substance of choice and get the relevant scientific literature. Secondly, you should go to erowid.org, E-R-O-W-I-D, and there is a wealth of information, listservs, comments, how to dose, what to dose, all the chemical stuff. It's incredibly comprehensive. Doing a risk-benefit analysis is crucial for clinical microdosing. So the first question is, obviously, how do you do a risk-benefit analysis? So let me help. So what's the primary risk factor here? The primary risk factor is you, and it's how you gain knowledge. Again, some people that are watching this may already be within a psychedelic community, kind of know what to look for, but I'm assuming you don't. So the question really comes, how do you gain knowledge? And if you're over here, with YouTube, then that's a concern because entheogens have co-evolved, we want to call them entheogens, psychedelics, plant medicine. They've co-evolved with humans over tens of thousands of years. But for the most part, it's done within community and with a specific purpose and with a specific intention. Nowadays, everything is compartmentalized. So if you need to learn a bit of coding, I need to learn something on MATLAB, or we need to learn something about the EEG, we go watch a YouTube video. You bring that mentality into microdosing, you're opening up a can of worms. So the risk-benefit analysis starts with you. How do you gain your knowledge? Given that microdosing, in my opinion, needs to be done within a community setting where people understand what you're doing, are being supportive, doing the lone wolf approach and sucking down different bits of information from the YouTube is not very safe. You don't go to the same person you might buy your recreational drugs from as the same source for microdosing. If you don't even know what psilocybin looks like, if you don't know what the mushrooms look like, then why on earth would you go to the dark web and order that? So first of all, when you're thinking about your risk-benefit analysis, think about community, think who you're connected with, and vet your sources. Now, there's a second problem, is that we're all comfortable around sources that we know, but they may not be accurate, they may not be truthful. Everybody has different sensitivities. Some people can microdose at a tiny bit and they feel it. Some people have to have a little bit more, but everybody has different sensitivities. So when you kind of chart your course, you need to take this into account. And yes, I hear this all the time in clinical practice. Oh, I'm so sensitive to medications. I take a little bit of this and I absolutely feel it. Plant medicines are in just a completely different realm of their own. And the only way to get a sense actually of how you're going to respond is to start with a tiny amount, probably on a Saturday morning when you don't have anything to do, and you have a partner or somebody there to help you navigate through this period of time. In my clinical experience in different countries watching people microdose, I have never, ever heard of anybody having a negative reaction to microdosing. But part of the risk-benefit analysis, as I mentioned a few moments ago, is also being within community and seeing how people do this. You don't, for example, there's different ways to microdose different things. You don't, for example, want to inject yourself with these substances. And again, that goes to how are you gaining your knowledge and how are you going to go forward. So just kind of want to underscore, though I haven't seen any negative reactions about microdosing, but my assumption in that and what I've seen is that it's always done by ingestion or by making some type of tea, certainly not by injecting or smoking or whatnot. The next area I think that's important on your risk-benefit analysis is to look at what it is you want to accomplish. And I would make it into three categories, whether it's an emotional need that you're doing this for, whether it's thought, or for example, whether it's something to do with the body. Now, with the body, sometimes people microdose in order if they have fibromyalgia, so they will microdose a bit for pain relief with the body. And we see that obviously with edibles, with the whole cannabis industry, how pain is a factor there. If it's thought, is it focus? Is it concentration? Is it ruminative, obsessive behavior? If it's emotional, are you looking to alleviate anxiety? Are you looking to alleviate depression? Kind of two sides of the same coin. So the question becomes, when you're thinking about yourself, what human domains do you want to alter? To keep you straight on your ongoing risk-benefit analysis, by all means, you need to keep a journal. And I don't mean a journal as, oh, today or yesterday I microdosed and I felt motivated. It's better if you, when you initially start, to record the time you ingested, how you ingested, the amount you ingested, and then kind of keep track, even if it's with a tape recorder, what you might feel. One of the things that people report when they microdose, like, oh my God, I'm feeling my heart. They think it's a panic attack. And I've actually heard this when I've watched people microdose. And then when you put a pulse oximeter or you test their pulse is like 55, 56. How is that possible? You're much more aware of your body. So keeping a journal on the specifics will help you go forward in microdosing, whether to kind of up it a bit or bring it down a bit. I think one of the, I don't know if I mentioned this or going to mention this, but one of the things about microdosing, as I said, it's subperceptual. In other words, you should not be able to really notice it that much. There might be a tiny uptick in mood, but you really should not notice it that much. So do your risk-benefit analysis. Consider yourself the primary risk in how you gain knowledge. Remember that these substances came from interpersonal community. They did not come from internet disconnectivity. You keep that in mind when you take a look at yourself and what you want to accomplish. and you'll be on much more safe and more firm ground. All right, now to define microdose, which is the absolute easiest thing in the world to do in this video. Let me tell you flat out, there is no scientific consensus on what constitutes microdosing at this point. So, what does that mean? You know, how do we then, what does that mean to microdose? The way I was taught by a provider in Mexico is that it's subperceptual. In other words, if you microdose and within 20 or 30 minutes you're staring at your hand or notice that the color on a plant is extraordinarily green, you've gone too far. It should be subperceptual. In other words, you should be able to do your work, go about your business, and you yourself would not know, neither would anybody else know. So in my mind, the way I look at it, the definition of microdose is behavioral stability. You simply cannot tell that you are microdosing, neither can anyone you are with. I want you to think about your expectations, but don't think about it in a temporally static form. Think of a continuum across time. Imagine your cognition across time, your mood across time, your behavior across time. What is it that you can expect from microdosing? So here, this is where I just share my direct kind of observations that people have. First and foremost, I would say you can expect mood stabilization. No, that does not mean mood happiness. That just simply means mood stabilization, which if you happen to be at one extreme, you're going to kind of come back to a medium, back to a mode type of mood. So if you're chronically depressed, as we've seen within the literature, actually on Full-Blown Journeys, published out of the UK, your mood ought to increase just a little bit. Just ought to be a little bit better. There's going to be less self-rumination. And this is a difficult concept, I think, to convey because so many of us, myself included, spend so much time in our brain looping. That's self-rumination. And self-rumination is highly correlated with addictive behaviors, highly correlated with depression, and don't freak out. It's also highly correlated with schizophrenia. The point being is that what we've seen, particularly with DMT, is that psychedelics overall, as a whole, lower the default mode network, which means less self-rumination. And addiction and substance abuse is associated with over self-rumination. So you're going to likely see a decrease in self-rumination and self-examination. What we've also seen, or what I've also seen, has been a very odd increase in motivation. You want to do things. And inversely, you want to avoid less. So, for example, people have reported that it's easier to pay bills. It's a little bit easier to return phone calls. It's a little bit easier to engage in social interaction. There simply is less avoidance. And there seems to be a little bit more motivation. So the next section is choices. What substances should you start with? Well, that's a trick question because that's absolutely the wrong question to ask yourself. Don't ask that. But I'm asking you to kind of examine, what do you put into your body? So do you put coffee in there? Do you put sugar, soda pop in there? Do you tend to put alcohol in there? Tend to put marijuana? What do you do for fun? Do you read or do you go bungee jumping? The point being is that anything that you are doing right now is an indicator of your basic neurophysiological infrastructure. And in my field, we talk about EEGs, for example, brain waves or brains that are easily aroused, overkindled. They kind of flare up very quickly. Those people tend towards more calming, sedative type of drugs, alcohol, opium, heroin, marijuana. We use substances to self-correct our neurophysiology. And that is the first thing, if you're going to microdose, you need to have an honest self-assessment with. The other thing that impacts your choices, maybe I should have started with this one, is the practicality of your choice. It is far easier to procure mushrooms than it is LSD. It is even easier to procure San Pedro because it's not a Schedule 1 substance than it is to procure psilocybin. It's very difficult to procure ibogaine, and it's more difficult to procure DMT. And the next thing in this practicality that you have to kind of sort in your mind is that organic sources tend to affect us differently than inorganic sources. So for example, DMT, the inorganic form is synthetic DMT. The organic form is ayahuasca or 5-methoxydimethyltryptamine from the Sonoran toad. So organic substances versus inorganic can have a varying effect on your system. That being said, LSD is, quote, inorganic, and it is extremely powerful at a microdose level. So the point here is when you're looking at your choices, you're going to have to kind of look at what's practical, what is impractical, what is your neurophysiological structure, that is, what are you attracted to, and think of that attraction to a substance as a possibility that your central nervous system is working to balance your system. And remember that the dosage is going to vary whether it's organic or inorganic. It is impossible to measure accurately the amount of psilocybin in any batch of mushrooms because mushrooms vary. They come from Oregon, they come from Arizona, they come from this place, that place. It's going to vary the content. It's the same thing with the Sonoran desert toad. You get it in a mating season, a rainy season, a dry season, an off season. So your dosage is going to vary and the quality of your experience is going to vary. The point here, once you kind of decide this, is that once you decide what you're going to get, my suggestion is that you get enough to carry you through a 30-day excursion into microdosing. And for that, I would suggest that you follow Dr. James Fadiman protocol of doing a substance for 30 days. So what you can procure, whether it's inorganic or organic, it's going to affect as well as it's going to interact with your neurophysiology. So finally, the caveats, warnings, admonition. It's a great thesaurus word there. I can sum it up this way. You cannot make up a life of mental and physical sloth by microdosing. It doesn't work that way. There's no instant gratification. There's no OMG, I'm now awesome at work. It's the only metaphor I can come up with is I don't go to the gym once for 30 minutes and then expect to run a marathon. Microdosing, well, we don't know what it does. We don't know the effects it has long term. There's no scientific study on long term, in part because I mentioned in dosing, we have no idea with some of these substances how to actually measure the dose. I mean, LSD, you think you can measure the dose, but it depends upon the chemist who makes it and where you get it from. So it's a bit of a problem. So there's no long-term studies on the effects of microdosing. What I can share with you, what I've seen with clients that I've sent to clinics in other countries that have dealt with things, is that what you're going to get a boost. It's as if you're scaffolding yourself into a newer realm, and then it's up to you to maintain those behavioral changes. There is no instant gratification here. And to think about like a magical cure, well, if I microdose with mushrooms, then I'm going to suddenly be happier. We've never quite seen that. We don't see quite a return to baseline, but generally after 30 to 40 days of microdosing, what we've consistently seen has been 6 to 8 months, a window in which a person can really work to maintain those goals that they've gotten and to scaffold themselves into new behavioral habits. So that would be my final kind of caveat warning, is to have realistic expectations and to not to confuse microdosing with full-blown journey. Think about this as a spectrum. On the one end, you have microdosing, which is sub-perceptual. On the other end, you have full-blown journey when all sorts of stuff happens and is reported in the literature. This end over here is not examined scientifically just very much. This end over here is receiving a lot of attention. Don't confuse what happens at this end with your expectations on this end. Stay safe.